Let's go through some of them. We have a graphic here, two graphics actually, that I want to show everybody. Let's start with the first one because a lot of these are popular myths when it comes down to diabetes. The first one, if you are overweight or obese, you will, and it's a will, eventually develop type 2. Myth or reality?
Both. If you are overweight and you do have the genes, you are most likely going to develop diabetes. But that doesn't mean that every overweight person will develop diabetes.
Eating too much sugar causes diabetes. Myth.
If you have the genes and the glucose intolerance or the resistance to insulin, yes, it'll worsen your diabetes, but not cause it. If you gain too much weight because you eat too much sweets, then that will potentiate or bring about your ultimate destiny of becoming diabetic if you do have the genetics.
The third one kind of catches me because it says the myth is that diabetes is not that serious of a disease. I can't think of a more damaging myth possibly. It's very serious.
Well, that's correct. Diabetes is a major cause of cardiovascular disease. And of course, the majority of the patients that are on dialysis or requiring transplants are diabetics, at least half of them. And in fact, for every one patient that reaches end-stage renal disease, which is kidney damage that's so advanced that you need to replace it with dialysis or transplant, for every one patient that reaches dialysis, 9 die along the way of vascular disease. And vascular disease is the major cause of death in diabetic patients and in patients with kidney failure.
Here's another one too, and I think this kind of catches me a little bit too. People with diabetes should eat special diabetic foods. Isn't it fair to say that there are cases where there might be some certain foods you want them to eat, but still this comes down to a diet that is just, you can purchase at any store? Well,
you need to really be educated to begin with regarding what you're eating. The American Diabetic Association has published significant guidelines to help people follow their diets. Obviously, if you look at the internet, there's overwhelming information overload. The first thing I suggest to my patients is go see a dietitian, and it's got to be portion control, quality of the food, and calorie counting and carbohydrate counting.